Assalamu alaikum. So today we are going to discuss the veins of the lower limb. So first of all, we must know that there are two types of the veins, the superficial veins and the deep veins. So the superficial veins, there are two superficial veins of the lower limb, and these are the great saphenous and the small saphenous vein. And there are also the deep veins, and these deep veins, they will accompany the arteries of the lower limb, and they will be also named according to those arteries. So these includes the anterior tibial vein, the posterior tibial vein, the fibular vein, the popliteal vein, and the femoral vein. And then there will be profunda femoris and the circumflex femoral also, etc. All these. Okay. So now we will see the superficial veins on this diagram. This is the femur, this is the tibia, this is fibula, this is the patella bone. So let's start. So we will start the veins from the lower side. Okay, from these fingers. So as this is lower limb, so on the medial side, this will be the thumb. This is thumb, and this will be the little finger. So first of all, we will discuss the great saphenous vein, which is the superficial vein. Okay, so this great saphenous vein, it is formed by the dorsal venous arch and the dorsal vein of great toe. So this will be the dorsal venous arch. Here I will draw it, which will drain these all. So this is the dorsal venous arch, and this one will be the dorsal vein of great toe. Okay, so these both combines to form the great saphenous vein. Okay, so now this is the great saphenous vein. First of all, label here, this is the dorsal vein of great toe, dorsal vein of great toe, and this was dorsal venous arch. They both combines to form this great saphenous vein. Now this great saphenous vein, it will move posterior to medial malleolus, as this is the medial side, so this will be the medial malleolus. It will move posterior to this medial malleolus. Sorry, it will move anterior to this malleolus. Here it will be anterior to this malleolus, and then it will ascends till it reach the condyles of this femur bone. Now here it will move posterior to this medial condyle. Here I am showing in the dotted form. Here it is posterior to this condyle, and then again it will ascends like this. Here will be a deep vein called the femoral vein. This is the deep vein of lower limb. Okay, and then it will drain into this femoral vein. So now we will see its several relationship here. So first of all, you must know that before entering to the femoral vein, here it will enter this saphenous opening. Saphenous opening, through which it will enter into the deep fascia, and then it will drain into this femoral vein. This was the medial condyle, to which it is posterior, and this is the medial malleolus, to which it is anterior. Now there are several branches of this. We will see those branches also. First of all, there will be a posterior medial tributary. This is the posterior medial tributary, which will drain the posterior and the medial side of thigh. medial tributary, and this is also called the accessory saphenous vein. Accessory saphenous. This is the branch of this great saphenous vein. Then there will be another tributary which will be the anterior lateral tributary. Anterior lateral tributary. It will originate at its level, but it will enter very superior to it. This will be anterior lateral tributary. Anterior lateral tributary. Tributary. Okay. Now the other three branches of this are here. We will write also those three branches. So the first one will be the superficial epigastric. Superficial epigastric. Then there will be external pudendal. And the last one will be superficial circumflex iliac. Superficial circumflex iliac vein. So these are all the branches of this great saphenous vein. This will be the great saphenous vein. Okay. So now we will see the small saphenous vein. That small saphenous vein, it will be on the lateral side, and it will form by the union of the dorsal vein of the little toe and the dorsal venous arch. We will see it like here. These both will unite to form the small saphenous vein. And now here this small saphenous vein, it will ascend posterior to this lateral malleolus. It will be posterior to this lateral malleolus, and then it will move on the posterior side of this fibula bone. But I will show here it as on it this. It is moving on posterior side. Remember this thing, okay? Then it will move here, and here will be the superficial vein called the popliteal vein. Here will be that superficial vein. This is also on the posterior side of the leg, and it will drain into this popliteal vein. Now we will see some relations. This is popliteal, popliteal vein, and this was the dorsal vein of little toe. Little toe, this was the dorsal vein of great toe. So dorsal vein of the little toe and this dorsal vein arch, they will unite to form the small saphenous vein. Here it will be posterior to this lateral malleolus. It was anterior, here it is posterior to lateral malleolus. Okay, now it is moving posterior to this fibula bone. Here, first of all, it will pierce the deep fascia. This will be the deep fascia. It will penetrate that deep fascia to move deep, and then it will move between the heads of the gastrocnemius muscle. Here will be the two heads of gastrocnemius muscle like this. It will move between these two heads, and then it will enter to the popliteal vein. So these are the two superficial veins of the lower limb, and for the deep veins, they are same as the arteries of the lower limb. Just you have to write the vein at the artery, and I am also giving the link of those arteries in the description. Thank you.